I know Mrs. Jovo had a question for you, Dr. Taylor.
And yes, Dr. Taylor, what are some causes of breast cancer?
So of course genetics. So of course
Mhm,
we can't choose our families. We can choose our friends.
mhm,
And so genetics is a key thing. Other risk factors would be, obesity. So we're always talking about just, that balance of diet and good nutrition, tobacco, which leads to all different types of cancers. Also, a term called nulliparity. So basically, if you've never had children, so if you haven't had any children by the age of 30, that increases your risk.
Really?
Um, it does. If you had
Oh,
early, if you started your periods early,
hmm.
that increases your risk, or if you
mm,
stop having periods late. And so really,
mhm,
it's basically just looking at the estrogen levels. And
Okay.
so
mhm,
individuals who start their periods early, it's like you're exposed to estrogen for a very long time. And or same thing for a woman who is menopausal after age 51. So average age of menopause is 51. For a woman continues to have periods after 51,
mhm.
that thought is that they're, have increased levels of estrogen. So they're also at an increased risk of cancer as well.
Okay.
Okay. I wanted to also ask, what about women who have a history of like fibroids or like polycystic ovarian syndrome, things of that nature? Is there a connection between that and breast cancer as well?
There's no direct connection, but I would say more of
Okay.
an indirect connection because
Mhm,
typically, the thought is that, fibroids are more likely seen in definitely in Black women. If you were to put 10 of us in a room,
mhm,
probably 7 or
mhm,
8 of us probably have had fibroids or had some issues with heavy menstrual bleeding. With
mhm,
PCOS or the polycystic ovarian syndrome,
mhm,
typically those individuals are going to be more obese. And so you're going to see, again, that increasing your risk factor
mm,
for
mhm.
cancer.
Wow.
Okay. Mm.
Okay. And you touched on this a little bit, Dr. Taylor, but can you give us some digestible, I guess, to-dos or digestible pieces of information that will help us have a healthy lifestyle and or diet that will help us prevent cancer?
Absolutely. So I won't say it won't completely prevent it, but you can reduce your cancer risk by
Right.
staying active. So doing at least 30 minutes of activity 5 times a day, 5 times per week. So 150 minutes minimum of exercise per week is important.
Okay.
And you can always break that down. You can break it down into like 3 10-minute increments if you have a busy day, or
Okay.
park further back in the parking lot, take the stairs. And so really just, take opportunity just to get more active. I think when you're going to the grocery store, shop the periphery, because when you go down the aisles and the Chips Ahoys and Oreos start calling your name. So really shopping like the periphery of the grocery store. So that's your fresh fruits, your veggies, your meats, and just hitting those items. I think, things in moderation. I think, really trying to limit things like, your fried food. There's some thought that alcohol also increases your risk.
Mm.
Um, so, when you're having like 2 to 3 drinks or more daily. And so that can increase the risk of cancers as well. So in regards to diet, I think just finding that balance in regards to, I mean, we all round up for the holidays. So I think just having that moderation where like maybe you're having a little bit of this and a little bit of that, but really trying to avoid things that are like fried and processed and things like that. And just trying to just do fresh fruits and vegetables. And
Okay.
that's a whole nother topic when we start getting into food insecurity and our neighborhoods not having access to those things.
Yes. And both of you all do diversity and equity work, correct? Both of you do, right? To some degree?
I
Or
do indirectly.
okay. And so we'll talk about that a little bit later. I definitely want to talk about that. We can't have this conversation without talking about that. But I have a quick question, and I know that Cannon has one as well. But I wanted to know if there's any truth to some of the things we hear about everyday products causing breast cancer, not just the foods we eat. For instance, I hear a lot about how deodorant causes cancer, or is it any type of cancer, or that's not true? Okay.
No, they did an extensive study to confirm that. And I think it was more recently, though, that the results came back. It was the aluminum in deodorant that was concerning, if that was contributing to breast cancer. And the study came back that there was no connection there. Am I right about that, Dr. Taylor?
I haven't seen that study, but I haven't seen that. Haven't had an
Yeah,
opportunity to see that study.
Okay.
yeah.
Someone has a
I want to
question.
say it was about 2 years ago.
Okay.
No, go ahead. Go ahead. Uh-oh,
She's
we lost
frozen.
her.
Oh no, I think I was just saying, I think it was about 2 years ago.
Oh, okay. Okay. All right. And I want to address some other myths. Someone has a question in the chat though. Titanium asks, are there any dietary changes that need to be made if someone is on radiation or chemo?
I didn't have any dietary changes on radiation. No, it makes you very tired and it can affect your infection fighting cells, the white blood cells, but they didn't give me any dietary changes. I do know, and Dr. Taylor speak more to this, for some chemo regimens, you can't eat raw food because you're very at a risk, almost guaranteed, that your white blood cells will be depleted, and so you won't have a real good immune system. And so like eating like lettuce even, I know anecdotally, when I was diagnosed in residency, I had a good friend who was also navigating another cancer diagnosis, and we would, commiserate around our diagnosis. And she was going through chemo, and would like microwave lettuce, because you couldn't eat that without, getting some. It's raw, and so things like that. I don't know if there's more.
Okay. Thank you, Dr. Taylor. Did you want to add on to that?
Nope, I have nothing to add.
Okay. Thank you. I know that Mrs. Cannon had a question.